Okay, good morning, everyone, and thank you so much for coming for this press conference. And apologies for the changes in the venue, which has caused inconveniences to you. My name is Dr. Herbert Ruswata, the President, Uganda Medical Association. Uganda Medical Association is deeply concerned about several critical health-related issues, including the ongoing crisis caused by the withdrawal of US aid funding, the impact of the Ebola outbreak, and the medical condition of a colleague, Dr. Kizza Besigye, and the appropriate remuneration of associate consultants. These challenges need urgent attention, and we offer recommendations on how they can be addressed to safeguard the health and well-being of Ugandans. The impact of USAID funding withdrawal. Uganda Medical Association expresses great concern regarding the inadequate prioritization of the health sector amidst the ongoing crisis triggered by the pause in the USAID activities globally. The withdrawal of the USAID funding, which has historically supported various key health initiatives, has exposed significant gaps in the health sector financing within Uganda. As a direct result, over 3,000 health workers, comprising doctors, nurses, laboratory technicians, and others, have lost their jobs, and many more at the verge of losing their jobs, creating a severe shortage in the qualified human resource. This has stretched the remaining health workforce, compromising the capacity of both the public and the private health services, providing essential care, more so to HIV and TB patients. Additionally, this crisis leaves over 1.5 million Ugandans living with HIV, stroke, AIDS, and TB, facing uncertainty in their future regarding their continued care and access to antiretroviral treatment. We urgently call upon the Ministry of Health to present a supplementary budget to Parliament that prioritizes the resolutions of this crisis. The proposed budget should provide for the reinstatement of the salaries for health workers previously funded by USAID projects and allocation of sufficient resources to ensure uninterrupted HIV and TB care, including procurement and distribution of reagents and all the necessary medications. Ebola outbreak response. Amidst the ongoing Ebola outbreak in Uganda, which was declared by the Minister of Health on the 30th of January 2025, we commend the government's swift response and efforts to combat the outbreak and contain its spread. However, there has been reports of non-payment of allowances to health workers who provided critical care to Ebola patients during the previous outbreak at Mubende Regional Referral Hospital. These unpaid debts have caused significant dissatisfaction among health workers involved, who we to date celebrate for having been at the forefront of the nation's effort to contain the virus. We urge the Ministry of Health to urgently settle these outstanding debts and ensure that health workers currently engaged in the treatment of Ebola patients receive timely and adequate compensation. Ensuring that health workers are properly motivated and supported with appropriate financial remuneration is crucial for maintaining moral and effectiveness of the ongoing response to the public health emergency. Rights of inmates to access quality health care. We are concerned about the complaints coming from our membership concerning the health of our colleague in the profession, Dr. Kizza Besigye, pointing out deterioration in his health and the possible worsening of the situation, which can lead to irreversible damage. We have written to the Commissioner of Prisons requesting for a medical report concerning the doctor's health so that we can allay fears among colleagues concerning his medical care, but also requesting his referral to Mulago National Referral Hospital for further assessment. We also wish to note that prisoners have a right to receive medical care that meets the same standard as those available within the community. This is in accordance to the UN Standard Minimum Rules for Treatment of Prisoners and the laws of Uganda, specifically Article 8A1 of the Constitution, recognizes the health as a right, stating that the state shall ensure the provision of basic medical services to all citizens. Additionally, Article 45 of the Constitution guarantees the protection and promotion of fundamental human rights, including the right to health. This includes the provision of care for all, regardless of their legal status, such as being detained in prison. As an association of professionals, we sow to nurture and protect life. It is our responsibility to speak out in defense of our colleagues' health. Remaining silent while fellow medical professionals' condition is questioned would be a betrayal to the very oath we took. Recognition of specialists as associate consultants. We appreciate the government's recent decision to change the title of specialists to associate consultants, a move that recognizes the critical role these professionals play in the healthcare system. However, this title change is commendable. However, while this title change is commendable, we gently emphasize the appropriate remuneration of associate consultants that needs their capacity and the work they are doing. The recent job evaluation conducted by means of public service has outlined new pay structures which we fully support. Therefore, we request that the government ensures the allocation of adequate resources in the budget of 2025 and 2026 to implement these new pay adjustments. Providing fair competitive compensation is essential not only for retaining skilled specialists, but also for motivating them to continue delivering high quality care in the face of increasing healthcare challenges. In summary, I will request the Ministry of Health to present a supplementary budget to Parliament to address the reduced to address the financial or the health sector financial crisis which we are having today. Number two, to settle outstanding debts for health workers who treated Ebola patients in the past and ensure timely pay for the current health workers who are managing Ebola patients during this outbreak. Provide a medical report on Dr. Kizza Besigye's health and request for his transfer to Mulago National Referral Hospital for further assessment. Implementation of appropriate pay for associate consultants in the budget for the financial year 2025-2026.
My name is Dr. Muyanga Andrew Mark, and I'm the Chair, Publicity and Mobilization of Uganda Medical Association. This is a special message from the Office of the Chair, Publicity. So the Uganda Medical Association yesterday called for a press conference to address key health-related issues affecting our country. Unfortunately, it has come to our attention that some individuals with ill intents are hijacking our call to promote false and divisive narratives. These individuals are claiming that Uganda Medical Association is calling upon citizens to rise against the government in response to the ill treatment of our colleague Dr. Kizza Besigye, who is currently in detention. Furthermore, we have come to learn that there are claims suggesting that we are planning to commandeer or call upon doctors to lay down tools, which is a decision which is simply being imposed on us. We want to make it absolutely clear that Uganda Medical Association has not made such a decision, and we categorically reject these unfounded claims. Uganda Medical Association is not a political organization, nor are we in the business of promoting any political unrest. Our only mandate is to promote the welfare of doctors within Uganda and ensure the delivery of quality health care services to our fellow citizens whom we swore to serve. We will not be coerced into agreeing with such claims, and we remain steadfast in our commitment to our professional duties. Any suggestion otherwise is false and misleading. We remain committed to our mandate and stand firmly in our responsibility to safeguard the health of all Ugandans. Thank you.
For the Federation of Uganda Medical Interns. The Federation of Uganda Medical Interns is a legally registered federation which is concerned with the welfare of intern doctors, intern dental surgeons, intern pharmacists, intern nurses, and midwives. Currently, we are having an outbreak in Uganda, that is the Ebola virus disease, and we well know that interns are always the first respondents when it comes to these kinds of outbreaks. Why? It's because we are the people who are always manning the emergency stations and OPD. So I want to send this message to my colleagues in the Federation, the interns in the various sites, that please be careful and observe all the IPCs, all the infection prevention control measures. At least ensure that as you are attending to those patients, you have the basic PPs like masks and the gloves. Where necessary, you should also have aprons. Let's observe the standard operating measures which were released by the Ministry of Health, because without them, we may end up being culprits of this situation. Therefore, let's take charge of our lives. It's also important as we take charge of the lives of those patients. I want to say this, that the Federation of the Uganda Medical Interns is standing in solidarity together with the Uganda Medical Association, advocating to the government for the release of Dr. Kizza Besigye, such that he is given an opportunity to go and have proper proper treatment or medical checkup, because it's a right to everyone in Uganda according to the constitution. I would want to appreciate our government for always standing together with the medical interns and the continuous support of the medical internship program, because we believe without them it wouldn't be ongoing. We appreciate them for the continuous payments that they have been providing, however small it is, but it has been coming in time. We understand that the situation is not okay, but we believe that working together, we can have a smooth running of this program, and it will continue smoothly. Thank you.
My name is Dr. Kizza Elias. I'm the chairperson, Uganda Medical Association, Ankole region. My message today is to the fellow health workers who are working amidst the challenges as they have been outlined in our press conference today, so that they can remain working as we hope that the government will hear our outcry and implement whatever we have said in this press conference. Thank you so much.
For the release of Dr. Kizza Besigye, because we believe that even prisoners have a right to get access to good healthcare services. We have seen him from the time he was arrested. His health keeps on deteriorating, but we should not forget that in the recent past, we are actually in a by-election at this moment because we lost Honorable Segiri Muhammad in prison because he was denied access to good healthcare when he asked for it. So we add our voices to the many, demanding that Dr. Kizza Besigye, who is our fellow medical professional, be given access and granted to look for good healthcare services because we see the state he's in and he deserves to be in a much better state. I also want to add my voice to asking or requesting that the Ministry of Health does come up with emergency solutions based on the recent USAID freeze. There are so many young professionals that have been working under that program and who have since lost their jobs, but we saw the PS asking them to volunteer, which becomes a bit very difficult for someone to volunteer in such a case. So I add my voice in demanding that these people be found a solution for, find a way to, make them live, because we are paying RDCs, we are paying assistant RDCs. That means we have the money to actually pay for these extra medical professionals because we need them.
Good day to everyone. My name is Adong Eric David, the Director, Standing Committee, Medical Education under the Federation of Uganda Medical Students Association. So I'm here to join hands in solidarity with our mother organization, our mother association, the Uganda Medical Association, in calling for the immediate release of Dr. Kizza Besigye to attend and receive urgent and unbiased medical treatment in line with national and international standards. Furthermore, I will call upon everyone that can offer support to our cause through signing a petition that has been shared demanding for the release of Dr. Kizza Besigye. And in addition to that, we call upon everyone to maintain the standard operating procedures as we are still battling an Ebola outbreak, and to all the medical students that will be returning to the wards, the training facilities. I encourage you all not to be scared, but to observe the SOPs, and all will be well. Thank you so much.
So tukiriziganya wamu mwenna ndowooza mukimanyi nti abasawo tuli bangi kugyeko ffe ba doctors, wali aba pharmacists, abakola mu ddagala, abasawo b'amannyo ne ba nurses. Ffenna nga twegasse wamu ekiwandiiko kino twakitaddeko omukono era nga tugamba nti kyandibadde kirungi nnyo tukitegeereko nti Dr. Kizza Besigye embeera gy'alimu si nnungi, era nga tusaba President akole ekisoboka kyonna okulaba nga Dr. Kizza Besigye ayimbulwa mu kaseera akatali kawala asobole okufuna obujjanjabi bwe yeetaaga, kubanga twamulabe ffe abasawo muyinza obutakimanya naye kati ffe twasobola okulaba omuntu omulabira ku feesi n'olaba embeera gy'alimu n'omanya nti ono nno alabika tali bulungi era yeetaaga okuyambibwa. So twakirabye Dr. Besigye okusinziira ku babadde alabika banga yabadde bamuleeta mu kooti ennaku ezisembyeyo, tulaba nga tali bulungi era singa abatafunye bujjanjabi bw'amangu tetumanya mbeera eyinza kuba etya. So tusaba era nga twagala bwe kiba kisoboka Dr. Kizza Besigye ayimbulwe mu kaseera akatali kawala nnyo. Ffenna twakiraba bulungi nti kooti yawa ruling n'esalawo n'egamba nti nno okutwala abantu nga Dr. Kizza Besigye mwene embeera gye balimu mu kooti y'abannamagye si kirungi, era nga kooti yalagira nti nno ayimbulwe, naye katugenda mu weeks 2 ekyo tekikolebwa. Ffenno ng'abasawo kiba kitwennyamiza, ate era ffe ng'abasawo tuli okukuuma obulamu bw'abantu okulaba nga bali bulungi. Awali amateeka mangi agafuga ffe abasawo ng'akwatagana na byabulamu, agamu go gava mu World Medical Association, aga human rights n'amateeka amalala mangi nti buli muntu alina eddembe okufuna obulamu obulungi. So amateeka gano singa tulaba nga tegaweebwa kitiibwa oba nga gali mu kumenyebwa, kitwennyamiza ffe ng'abasawo era nga twagala babeerewo ekikolebwa okulaba nga embeera teyongera kusajjuka. Waliwo olukiiko oluyitibwa World Medical Association. Luno lwe lukiiko olugatta abadokita bonna mu nsi yonna era nga olwasembayo lwaliwo emyaka 12 emabega. Ekyewuunyisa nno eyalukulira baali bamuyita Dr. Margaret Mungerera era nga yali president w'ekibiina ekitwala abasawo mu Uganda. Kibi nnyo nti yatufaako, omwoyo gwe tusaba Mukama aguwummuze emirembe. Naye ng'era abasawo bonna wamu nga beegasse wamu bakkirizaganya ne bagamba nti nno eky'okubonyaabonya abasibe si kituufu era baakivumirira nnyo. Ekyokubeera n'abasibe nga balwadde nga tebafuna bujjanjabi si kituufu era baakivumirira nnyo. Era naffe tukubiriza era tugenda maaso n'okuba omulanga nti nno ebintu bino ebyasalibwawo mu lukiiko luno beeyongere okugobererwa, tulabe nga abantu abo naddala abalina obulwadde oba abalwadde mu makomera basobola okufuna obujjanjabi bwe babwetaaga. Then tusaba abasawo bannaffe abalala bonna, bayintaani, doctors, pharmacists bonna beegattire wamu tulabe okulaba nga omulango guno gugezaako okuwulirwa. Tukikkiriza nti nno Dr. Kizza Besigye singa batafunye bujjanjabi bwe yeetaaga mu kano akaseera, embeera eyinza okweyongera okuba obubi kitutandyagadde. Amateeka nkumuliitu mangi nnyo agogera ku mbeera eno nti singa omuntu abeera nga musibe n'afuna obulwadde alina engeri gy'akwatibwamu. Ng'oggyeko ago waliwo n'amateeka malala mangi agatambula n'ekyokuyisa obubi abasibe, okubatulugunya. Ripooti tuziwulira nga bulijjo nti nno oluusi abasibe bayisiddwa bubi, naye ng'amateeka nkumuliitu njabbawaako kaagamu ku go. Waliwo eyayitibwa World Medical Association Declaration, eno yali Edinburgh, yali mu mwaka gw'2000 ng'eyogera ku bya obulwadde buno obutambula tuyitibwa communicable diseases, naddala tugambe mbasibe. Newabeerako n'ekiwandiiko ekirala kyali kya Nelson Mandela. Nzamwena mukimanyiko nti Nelson Mandela naye yasiibwa ebbanga ddene. Ekiwandiiko ekirala kyali era nakyo World Medical Association naye nga kyali kya Tokyo mu Japan. Waliwo n'ekirala ekyali Hamburg, Germany, n'ekirala ekikwatagana naffe ba physicians. Twagamba ebiwandiiko bingi naye nga byonna bw'ogenda n'obyetegereza bulungi biraga nti nno kiba kikyamu era kiba kibi omuntu abanga alinamu obukosefu tugambe nga ali mu ddwaliro obutafuna bujjanjabi baba yeetaaga. Ng'oggyeko ekyo nti ekyokufulugunya abasibe kintu kikyamu ddala. So nga maliriza tusaba President Museveni wamu n'abo bonna be twogeddeko, Speaker, Ssaabalamuzi, abatwala amakomera okukitegeera nti nno twenyamidde olw'embeera Dr. Kizza Besigye gy'alimu era nga okusinziira kwe tumulaba ne reports ze tuwulirako oluusi abamu ku ffe tukyalayo ne tumulabako okusinziira ku tulaba nga obulamu bwe bweyongedde okuba mu katyabaga. So tukubiriza gavumenti yatusaba ekikolebwa kyonna kikolebwe okulaba ng'afuna obujjanjabi bwe yeetaaga. Bwe kitakolebwa ekyo tweralikidde nti nno tuyinza okufuna amawulire amabi kitutandyagadde. Mwebale nnyo, mwebale ddala.